Hi there, this is Dr. John Whitcomb talking about nitric oxide and your heart. That's where it was discovered in 1991, and that's what the Nobel Prize in 1998 was given, the effect of nitric oxide on the heart. And half of us die from heart disease. So this is not a minor topic. Here's the problem. When we are 20 years old, we have a fair amount of nitric oxide, but with basically every decade in life, you lose about 12% of your nitric oxide. So by the age of 50, 12 times 5, 60%. Age 60, 70-some percent. Age 80, you're getting up to 90. You've lost the vast majority of your nitric oxide. And nitric oxide turns off oxidative stress. And that turns out to be the first step in developing coronary artery disease. The steps of coronary artery disease go as follows. When you're under oxidative stress, the sheer effect of blood flowing through blood vessels damages the lining of the blood vessels, and you get endothelial dysfunction. And the lining of your arteries gets sticky. In fact, if you look at an artery under electron microscope while it's beating, it's actually got wavy little fibrils that look like almost like seagrass, that wave and move with the motion of the pulsatile effect of blood flow. And we also know that there's probably water in a charged, what's called the fourth state of water, that's repelling the surface of the arteries. And that is also dependent on healthy endothelium. Well, that's why arteries stick. And then the LDLs stick and they come into the wall. They start climbing into the wall, and before you know it, you have macrophages coming trying to eat the fat that's in the LDLs. And then you get foam cells in the wall of your artery and you're off to the races. And it takes 30 years before the heart attack actually happens, but that's the process. Well, that's all dependent on nitric oxide. And as a corollary effect, do you know that athletes, their athletic performance is completely dependent on how much nitric oxide they make, because that defines how much blood flow they have. And in fact, you can make the argument that virtually every disease in medicine is dependent on the amount of blood flow to an organ which is driven by nitric oxide through your arteries. Okay. Question is, can we get nitric oxide from supplements? And here we have had the promise of maybe arginine, which is how we endogenously make it, would be helpful. But we've had 2 studies that have just been published showing that no, you can't. When you take arginine, for some curious reason, you have worse outcomes, and worse outcomes for peripheral vascular disease as well. So that doesn't work. But there's another pathway. And the other pathway is, can you get it by your endogenous pathway? And here is remember how we make nitric oxide, is when we eat lots of vegetables or take nitric oxide lozenges, the nitrates get into our bloodstream and get concentrated in our saliva. And the nitrite, from there, they get changed by the bacteria in the crypts of your tongue and your taste buds if you don't use mouthwash. And then, when you swallow your saliva, it goes to your stomach where it gets changed into nitric oxide. And that turns out to have a dramatic effect. If I give you nitric oxide when you're having a heart attack in a mouse model, I can reduce the size of the heart attack dramatically. The same thing with liver damage. If I give a obstruct flow to a liver and give nitric oxide, the liver doesn't get damaged. So there's clear evidence that in the short term, nitric oxide is very valuable. If you're ever having a heart attack, you should have nitric oxide at home and be taking it. But probably everybody over 60 should be taking it twice a day anyways. And that's what we're going to eventually find out, because your nitric oxide production declines so much with aging. So first of all, the dietary approaches to stop hypertension, the DASH diet, is as good as the Mediterranean diet at making nitric oxide. So if you eat lots of vegetables or a Mediterranean diet, lots of salad, you can get a dramatic increase in your own nitric oxide. Start with that. Otherwise, do what I do. The N101 company, cute little take on nitric oxide, is making lozenges. They're first to market, so they're a little bit pricey. We're going to have competitors that are making pretty good product pretty soon. But for now, consider taking nitric oxide lozenges twice a day. Your blood pressure will drop 4 or 5 points when you do that. And 4 or 5 points is enough to reduce stroke by some 30-40%. Huge return. So it's actually a valuable thing, and actually they taste pretty good. Nitric oxide, good for your heart. Maybe the reason we're having heart troubles, we don't have enough of it. Get on it. Dr. John Whitcomb for News and Nutrition.